Hi, my name is Susan Freeman. I know that living in the Fort Bragg area, we would be very hard-pressed to find many individuals who haven't heard of the term PTSD or post-traumatic stress disorder. Today, I would like to share my family's personal experiences with you in the hopes that our battle may reach someone out there who is struggling themselves. My husband has proudly served in the Army for 7 years. He served 17 months in Iraq as well as 15 months in Afghanistan. After he returned from Iraq, our lives quickly resumed to normal. Unfortunately, after his return from Afghanistan, I realized that our lives have changed forever. While in Afghanistan, I received a phone call in the middle of the night stating that my husband had been involved in an incident. I learned that that particular incident was the detonation of a 900-pound IED. At that point, that was the largest successfully detonated IED in the country of Afghanistan. I would like to show you a visualization so you can picture the traumatic event that my husband experienced. The first image I'm going to show you is a before image of the truck that my husband used for most of his missions while in Afghanistan. You'll notice that this is a rather large vehicle. My husband is not a small man. And I would also like to show you the aftermath of his experience. Post-traumatic stress disorder occurs when someone has witnessed or experienced a traumatic event. Post-traumatic stress disorder is not limited to combat experience. It also affects people who have gone through sexual or physical abuse, serious accidents, terrorist activity, any sort of very traumatic event that may occur. And post-traumatic stress disorder is the aftermath. It's known as the injury that isn't seen because it can't be detected with an MRI. It can't be detected with an X-ray. It's detected by the signs and symptoms that someone displays after they've experienced the traumatic activity. And I'd like to share a few of the symptoms with you. I know that you can see on the PowerPoint a very lengthy list of signs that would indicate someone may be experiencing PTSD. Anger and irritability, difficulty sleeping, nervousness, headaches, nightmares, guilt, reckless behavior, relationship problems, isolation, stress, anxiety, alcohol or substance abuse, difficulty concentrating, feeling on edge, hopelessness, eating problems, chronic pain. I began to notice that my husband exhibited many of these symptoms. But like most wives, I wanted to believe that everything was great with my husband, that he would return to normal. He just needed some additional time. But unfortunately, we found that that wasn't the case. My husband was conscious during that explosion, and he remembers everything that happened to him. So those events are essentially frozen in his mind. And it, in a sense, paralyzes him at times with fear, anxiety, and many of those symptoms that we just discussed. Now, what we have done together as a family is we've attempted to move on from this. We've attempted to treat the problems that he is experiencing. PTSD can't be treated with a magic pill, unfortunately. PTSD is treated with a combination of medicines and therapies. My husband has tried many different programs. He has tried medications in combination with cognitive therapy, which is essentially sitting down with a therapist one-on-one and discussing the events. Unfortunately, we moved to a second treatment, an expressive therapy type of treatment where he would visualize the problems that he experienced. And now we've moved to a new treatment that we hope to see some great results from. And this treatment is called EMDR, which is a process that a counselor initiates with a rapid eye movement type of therapy. So we're hoping to see some dramatic improvement from this particular type of treatment. Now, as a wife, I want to protect, nurture, care for my husband. So I found myself in a situation that I needed to reach out for help. I realized that, unfortunately, my husband is experiencing a severe disorder that wasn't going to resolve itself. So I'd like to talk a little about how you can help. If you know someone who is exhibiting the signs that I discussed, reach out to that person. Discuss what they may be experiencing. Ask them if they have gone through those symptoms. Are you having difficulty sleeping? Are you having difficulty interacting with your friends? It is very crucial and it's very important to catch or to identify someone who is suffering from this disorder. Unfortunately, the man that drove the truck that was with my husband has passed away. He didn't pass away from the accident itself. He passed away from suicide. He passed away because no one was able to intervene on his behalf and ensure that he received the care and treatment that was necessary. PTSD is a real problem. It may not be seen, but it's a problem that cripples families, it cripples lives. It's a problem that we face every day in the types of activities that we can engage in. It can be treated. There is hope. I would suggest that if you know someone who has experienced a traumatic event and who you feel is withdrawing, again, exhibiting any symptoms such as dialogue indicating that they would consider suicide, I would suggest that you intervene immediately. Research the issues. Contact the local Department of Veterans Affairs. There are many, many, many websites online where you can find useful information that will help you to identify if this actually may be post-traumatic stress disorder. Our family is in the process of rebuilding. I know that we have a long road ahead of us. We face many obstacles, but together we will overcome this disorder. Thank you for your time. Thank you for your attention. And again, I would like to urge you, especially in the community that we live in, that if you know someone who is exhibiting these types of problems, seek help. You may save their lives. Thank you, and have a great day.